I never actually decided from my childhood that I wanted to become a doctor, but I was around medicine and dentistry all of my life because my father was a dentist. At the end of school, I went through all the processes of taking the medical college admission test and taking yes, they were hard, and taking the classes that were prerequisites. I applied and I was accepted. Then I got married, I reapplied but withdrew that application, and the idea of going to medical school just never went away. I started medical school when I was 28 years old and started thinking about what area I wanted to go into. I had decided that there were two things that I was not going to do, and one of them was pediatrics and one was, of course, OBGYN. When I started medical school, I was one of 9 women. And there was only one woman who was actually teaching on staff at KU Medical Center. And although I admired her, I didn't have a really close relationship with her. And so I was a little bit of a pioneer in my field. I was the first woman OBGYN in Topeka. And so everything that I did, I kind of had to create on my own, which I didn't think too much about it, to be honest with you. I did my work. I didn't think about being the only woman, except that I knew I was getting way creamed, way overwhelmed with my work. There was a lot of variety in that field. There was office work, there was surgical work, and I liked the variety. I also liked the fact that it was more positive, more preventive. You could fix things and the problem was done. It's a happy, very positive field of medicine, and I really, really liked doing it. In my business and in my medical practice, probably the thing I'm most proud of is having at least made the effort to treat every person as an important person and to explain to them what in lay terms so that they can understand, give them options as far as treatments go, and do the very best that I could for patients. The field changed a great deal when I was in practice. Babies still come out basically the same 2 ways, but there are a lot of other innuendos and a lot of other details that change through time. I'm most proud of my family and how my children have grown and how they're behaving in life and the good that they're doing. And I know that may sound a little bit trite, but it's really true because I think that leaves a legacy and that can have an incredible ripple effect through time and generations. I would advise women to be confident and to know that what they're doing is the right thing and not be afraid to say what they know is right. Never forget that people are helping you along the way, because that'll help you remember to help other people as well. So be appreciative for the help that you've been given. I retired from medicine because it was just not something that I could do anymore. I guess you'd have to say I was a burnout case because I worked so hard. I worked for 23 years, and I like to say that I crammed 40 years of work into 23 years. So I really just couldn't do that anymore. I really don't like to sit around and do nothing. I don't particularly I enjoy being entertained, but I would much rather be active and doing something than I would sitting there and letting somebody do things for me. It goes back to treating people with kindness and love is the right way to be in life. And if I act that way, and if everybody acted that way, I know that I'm much happier, and I know that the world would be a much better place.